Here's your host and publisher of Tonic magazine, Jamie Bussin.
Dr. Shantanu Gaur graduated summa cum laude with a BS in biology from Harvard College and with an MD from Harvard Medical School, where he was a Paul Revere Frothingham Scholar and a Paul and Daisy Soros Fellow. He's a proud first-generation Canadian of Indian descent, and he is an inventor of over 40 patents and has authored multiple peer-reviewed publications. Dr. Gaur has been featured on CNBC and Bloomberg and invited to speak on obesity and medical device innovation at numerous worldwide events. Welcome to the show, Doctor. How are you?
I'm doing great. Thank you for having me on, Jamie.
Well, I think it's really timely. There's a drug out there, which in Canada, we can't say the name, or we can't discuss what the drug does, but I think now with all the press, everybody knows what Ozempic does. But it's just one of the options for people living with obesity for whom diet and exercise doesn't work. Can we go through what the options are for people like that for whom diet and exercise just isn't an option?
Obesity is a really chronic disease, and it's a complex disease. It has really complex underlying biology. And so when I was at Harvard studying to become a doctor and actually starting Allurion, we got very interested in how you actually go about treating obesity. And obviously, first-line therapy is diet and exercise. Almost everyone tries it, but very few people end up satisfied with the outcomes. And the question is often, what next? What can you do after you try diet and exercise? And we live in a world now where there are actually quite a few options, and not every option is suitable for every sort of patient or every sort of consumer, but there are multiple options available. The way I see the world, there's a stepwise approach that you can take as you move through the different options beyond diet and exercise. First, there's very non-invasive, very simple devices like the intragastric balloon and other devices that can be administered without any systemic side effects and without any complications or very few complications, and can be done relatively easily and very conveniently. And then the next step up might be weight loss drugs like Ozempic, although there are very many different types of weight loss drugs that are out there. The issue with some of these weight loss drugs is that they can be very expensive. In the United States, these drugs are over $1,000 a month. In Canada, they're a little bit more affordable, but still a few $100s a month. They can lead to side effects. You have to inject yourself with the drug once a week. And typically, patients really need to take these drugs for a lifetime in order to keep the weight off. And with longer-term use, you start seeing the potential for very serious side effects, thyroid cancer, pancreatic cancer among them. So the drugs are not something to be taken lightly. They need to be really prescribed with a doctor involved, and they're really not for everyone, but they can be a good option for some. And then you have the option of bariatric surgery, which can be very effective for someone who has severe obesity. But if you look at the data, only 1% of people who actually qualify for bariatric surgery go on to get it because they're afraid of the complications, they're afraid of the side effects, and frankly, it's quite expensive when it isn't reimbursed. And when it is reimbursed, you might have to wait several years, especially in Canada, to even get the surgery or get consulted on it. So we do live in a world where there are a lot of different options for patients, but you really have to go through a stepwise approach to find the right one.
You touched upon some of the side effects of gastric bypass. Can you sort of summarize them? Like, what sort of complications are there?
For gastric bypass surgery and really any type of weight loss surgery, you can incur a lot of side effects. You're going through a pretty invasive surgery, whether it's laparoscopic or open abdominal surgery. You could get infections at the surgical site. You can have the potential for malnutrition if the patient's diet isn't managed correctly. You can have all sorts of issues in your intestines, whether it's obstruction or other mechanical issues that may actually require a reoperation. And so, as you can imagine, surgery is not something to be taken lightly. Neither is the anesthesia that you need to get as part of the surgery. people who have a higher BMI and who are struggling with obesity, they're actually more likely to have complications from anesthesia, whether they're cardiovascular complications or something else like a heart attack. So surgery, like drugs, can lead to systemic side effects, and it's, again, not something to be taken lightly. And the point here really is, no matter what you choose, whether it's our intragastric balloon, which is now on the market in Canada, whether it's a drug, whether it's a surgery, it has to be accompanied with a behavior change program. And ideally a remote patient monitoring solution. Because without that, you really can't get lifelong results that actually last. The way you treat obesity in the long run is actually by changing your lifestyle and changing your behavior. And these therapies, whether it's a balloon, drug, or surgery, are a means to that end. And so when you look at this universe of options that patients and consumers have available to them, really none of them, except for what we developed at Allurion, comes with a full program and a full package to help patients over the course of a lifetime.
Can you explain what the difference is between bypass surgery, which may or may not involve a sleeve, and a gastric balloon?
Bypass surgery and sleeve surgery and lap band surgery all fall under the category of bariatric or weight loss surgery. There are different techniques used for different types of patients, but they all effectively accomplish the same thing, which is they restrict the volume of the stomach. Right. And in the case of gastric bypass, they actually lead to differences in how nutrients are absorbed, which also assists in weight loss. The primary effect, though, is really driven by restricting the volume of the stomach. So surgery does that by actually removing part of the stomach so that your actual stomach is lower in volume and can't actually accommodate as much food. The gastric balloon does that by actually filling up the stomach. And what we've developed at Allurion is a balloon that actually can be swallowed in a capsule. It doesn't require any procedures, no endoscopy, no anesthesia, obviously no surgery. It can be placed in a 15-minute office visit, and once the balloon is inside your stomach and it's filled up through our tube, you actually have most of your stomach's volume full. There's a half a liter sized water-filled balloon sitting inside your stomach. And importantly, our balloon's not absorbed into your bloodstream. It has no systemic side effects, but it stays inside your stomach and helps you feel full, just like removing part of your stomach would do. And the sort of beauty and elegance around the solution is that, unlike surgery, which can lead to permanent modifications to your digestive tract, our balloon degrades and passes out of the body 4 months later. And it's paired with a behavior change program and remote patient monitoring solution that actually helps you change your lifestyle and change your behavior so that the 30 pounds on average that you lose over 4 months actually can be maintained over a long period of time. The issue that often happens with surgery is that a patient will get the surgery, their lifestyle isn't modified, their behavior isn't changed, and they end up putting the weight back on. And unfortunately, at that point, the patient's really at the end of the road and can't really have any other interventions.
So with a balloon, you say that it degrades and then it passes. Is the balloon then replaced, or is it the intent that the behavior changes after 4 months, thus another balloon isn't required?
We've treated now over 100,000 patients around the world with our balloon program, and our average weight loss is 15 kilograms or 30 pounds on average in 4 months. Our patients will maintain 95% of that weight loss at 1 year. And that's because they will continue to use our behavior change program and our remote patient monitoring solution. There's all sorts of AI and machine learning built into there to keep the patient engaged and keep their weight off. If the patient wants to lose additional weight, or if they need some help maintaining their weight loss, they can always come back and get another balloon. One of the beauties now that we're available in Canada is we're actually starting to see that sort of come to life and evolve as we launch even further inside Canada. Every patient has a different need. Every patient has a different weight loss goal. The beauty of the balloon solution is that it's temporary, so it can be repeated, but it's also paired with a program that can lead to longer lasting and in some cases lifelong results.
Is there a limit on how many times you can put a balloon in?
No, there's no limit. In fact, we've had patients who have used our balloon serially over the course of several years. And that's sort of the point. You know, obesity is a a lifelong chronic disease. Even if you don't have clinical obesity, maybe you're just overweight, people struggle with their weight for the entirety of their lives. You have issues that come up as you age that make it even more difficult to lose weight. And so the idea behind Allurion is we've created a program that can be repeated, can be modified through the use of artificial intelligence and machine learning, actually can be personalized to each and every single patient. And that's really the future of weight loss care. There's no one-size-fits-all solution, but solutions can be tailored and personalized so that they can provide the maximal benefit for the maximum number of patients.
Thank you so much for coming on the show today.
Thank you so much for having me, Jamie. I really appreciate it.